I just.
Oh, there we go. Got it.
There we go. Okay, great. So I just want to make everyone aware that we do record the session, as you said, Albert, so that if anyone is interested in joining us but unable to make our schedule, they'll be able to go back and listen to the Q&A later, as well as all of you will be able to do that as well. So I'll introduce myself, and I will kick it back. So my name is Elizabeth Topper. I'm a faculty member at the Johns Hopkins Bloomberg School of Public Health and have been for about 20 years now. My field is epidemiology. And I also, in addition to my research in epi, I also serve as director of the OPAL programs, the online programs for applied learning, of which the Master of Applied Science in Patient Safety and Healthcare Quality is a member of that family, and directed by Dr. Albert Wu. So Albert, I'll let you introduce yourself as well.
It's your favorite, isn't it? Come on, you can.
Of course, it's my favorite. Absolutely, but please don't tell the other program directors that I said that.
We won't let them listen to the recording. So I'm Albert Wu. I am an internist, and I run a Center for Health Services and Outcomes Research. In the School of Public Health. I am a core member of our Armstrong Institute for Patient Safety. I'm a general internist and otherwise a professor, I guess, of health policy and management and medicine primarily, and the director of this program from the start, and very happy to have you here with us. And could I get, actually, we've got a few folks who are helping run things, but do you want to just say hello quickly, Christina?
Hi, everyone. Christina Potter. I'm the program manager for all of the OPAL programs. So I work very closely with Dr. Wu and Dr. Topper and the other folks on the call.
Thanks so much. And Aiden?
Everybody, thanks for joining today. My name is Aiden White, and I am the Student Services Coordinator for OPAL programs.
And Ashley?
Hi, everybody. My name is Ashley Conroy Tabrizi, and I am the Senior Academic Program Coordinator for OPAL.
Morgan, you want to say hello?
Hi, everyone. I am Morgan. I am the admissions officer for OPAL.
So this is sort of group therapy in a way. We're a group of therapists or something. Maybe we need therapy. But we have a special guest, Michelle. Would you introduce yourself?
Well, that's nice. Hi, my name's Michelle Wright. I'm zooming in here from Southern Vermont. I graduated from the OPAL program this past May, so happy to be here and answer any questions people might have.
And what are you doing up there in Vermont besides, tapping maple syrup and shivering?
Right. Yeah, it's really charming up here. My job, since I graduated with this degree, I've now taken on the quality project manager position at my small community hospital. We have a little hospital here with a very small quality department, and it's been sort of my passion, and the department's been growing since developing the skills that we really needed here. So really grateful for the program and all the training I got.
Oh, well, you may get more questions than we get. So thank you for joining us. This was an innovation. We realized that it would be great to have you on, or someone who'd been through the program and who has a slightly different perspective than those of us who are running it. Let's see. So let's go ahead. We are going to talk about a little bit about the patient safety field. Many of you are already familiar. We're going to talk about a lot of the details of the program itself and the curriculum, the platform, and our esteemed faculty, and then some details about admissions and financial aid. And then I'm hoping we have, sort of almost half of our time together to answer any questions that any of you might, you might have. And even before we do that, if anyone wants to introduce themselves, and we can tailor what we present in the next 20 minutes or so, more or less directly to you. So it's if anyone cares to pop their camera on and say hello and introduce themselves, that would be great. Not required, however. Maybe we will get to this in, I usually have trouble finding the button to turn my camera on, or even to unmute myself, but in any event, let's go ahead. So one of my colleagues and a co-director of this program, Peter Pronovost, said that was quoted as saying, organizations profess patient safety is a top priority, but they're still trying to figure out how to manage it with the same rigor, discipline, and accountability that they do with their budgets. And patient safety gets more and more love from all around. I think that it's, what's not to like. But I think that in many cases, people just don't know how to do it. As you well know, patient safety or patient safety problems are really important in healthcare. For hospitalized patients, perhaps 1 in 10 on average is injured in some way or other during a hospital stay. There are at least 1.5 million preventable adverse drug events in the US every year. On the other hand, those who study diagnosis suggest that misdiagnosis may be even more common and can sometimes be even more catastrophic than medication events. And there are so many other things that can go wrong. Next, please. There are more and more frontline clinicians and managers who are translating their enthusiasm and their commitment to keeping patients safe and doing best by them to actually working in this field. The challenge, I think, in general, is that there are not enough people who have the expertise and the education and the training in both in patient safety itself and then in sort of skills that are required to do the work, including thinking how to design safety improvement projects, how to analyze the data, how to measure safety, and how to lead in this area. The concepts that we will be that we teach in this course and that we train to also are increasingly fitting into job titles that people already have or would like to have potentially, including some of the following. I won't read them all, but Director of Quality Management and Patient Safety Officer, Nurse Director of Clinical Quality Improvement, Director or Vice President of Quality and Safety, Patient Safety Officer or Consultant. All of these are all actual titles that our graduates have, and some of you may have, in fact, already, or that some of you may move into after completing this program. Next, please. So this is a full-fledged Johns Hopkins master's degree program. However, it's oriented a little bit differently than many of our other programs, which are more, I would say, sort of strictly academic. This is really intended to be a little more skills-based, and it's oriented, we expect that our students are primarily working professionals or would like to be working in this area. It's part-time and 100% online. It is 48.5 credits, and in general, people do this over the course of 2 years. Hopkins is on a quarter system, So there are 4 terms every year. And people often take 2 courses or even 1 course in each of those terms. There is regular didactic material, but there are also sort of skill development and professional development activities, and there is a summary integrative activity, a project essentially, that is the culmination of the program. It is very skills oriented. We would like to give people tools to use. This is an accredited public health master's degree. And the primary goal is to educate students on the measurement of safety and quality, on designing safer systems, on how to affect organizational and cultural change, patient-centered care, and very centrally to prevent harm from healthcare. Next, please. So here is how it's put together. There are a few courses that are required for any master's degree in public health. And so those are scattered in with courses that are strictly patient safety material. The course starts off with, actually we flipped this now, in the first term, an introduction to the science of safety, as well as a general seminars course. In the second term, an introduction to quality of care, and an interesting study, course on case studies in quality and safety, with examples from different settings and in fact different countries. In the third term, there is a writing course, which I think is oriented towards our material, but I think I spend more of my time writing than I ever thought I would, and I really find this very valuable. There is the first of 2 terms of epidemiology. In the fourth term, there's the first of 2 courses in biostatistics or statistics. But there's also a very useful course on leading for change, particularly change in its quality and safety. In the second term, there's the second piece of the biostat curriculum. There is a very practical course on quality improvement tools. There is the second term, there's the second basic epi course, an advanced topics in public health. Third term, it is all patient safety, measurement and evaluating patient safety interventions, and infection prevention, something which has wound up being increasingly important. And then the fourth term is dedicated to a measurement lab, which to help you practice your skills in measuring quality and safety. And this is useful in helping put together the integrative activity, which is generally a project of your selection. In many cases, people use this to design something that they would like to do in their work, but other people do things that are just more of general interest. Next, please. This is a truly interdisciplinary effort. And it's a collaboration between all of the schools at Johns Hopkins, in healthcare, the School of Public Health, the School of Medicine, and the School of Nursing. Welcome, Arti. Virtually all of the instructors are members of the Armstrong Institute for Patient Safety and Quality, which is certainly one of the leaders in the field worldwide. All of our instructors are people who are currently working in patient safety, either in practice or in research. We have, Johns Hopkins was really out in front in online learning. Liz helped lead that charge, but we've been teaching online courses since the beginning of the 2000s. And in fact, during the pandemic, every one of our courses, of which there are hundreds, converted to fully online for the duration of what was essentially the lockdown. the courses are kind of fun. They're produced with really high production values and they're engaging. The faculty have recorded all of the lectures to provide so that you can consume them anytime you like, but there are live talks mixed in through all of the courses. Next, please. There are, I think, one of our greatest assets, our two greatest assets, I think, are our students, because you always learn from one another. And I think people form really strong bonds with their classmates, despite the fact that it's strictly online. But just to name a few, Matt Austin is someone who measures and ranks the quality of institutions. He's actually in charge of quality and safety measurement for the Leapfrog group. Sydney D is a internist who leads our quality of care course, and she in fact is leading the AHRQ's current review of state-of-the-art of patient safety in the US. Lisa Maragakis is an infectious disease physician. In fact, she is the director of hospital epidemiology and infection control for Johns Hopkins, and was the lead incident commander for our COVID command center for the first 2 years of the pandemic, and was probably the most powerful person in the whole institution for a minute. Jill Marsteller is a leader in evaluation. Lori Payne is our hospital nurse, is a nurse, but who's our hospital director of patient safety. Mike Rosen developed the Team Steps program for AHRQ. Kathy Sutcliffe developed the theory of high reliability organizations, and really invented a lot of the concepts that now we try to use all the time. These are just a few. I could spend more time extolling all of them, but it's a terrific group, and they are all current leaders who are working in patient safety. Next, please. So what about admissions requirements? Liz, do you want to talk about this for just a bit?
Sure, thank you. So we use the common application system for schools of public health called SOPHIS, which I think might actually stand for Schools of Public Health Application System, if I'm not mistaken. And so we have a QR code on the last slide so that you can link right to it, but you can just Google it and you'll find it. So the applications are all processed through SOPHIS. We require a bachelor's degree from an accredited college or university and a minimum of 3 years of health-related work experience. As Dr. Wu noted, this program is really designed for sort of mid-career working professionals. So that's not to say that those are the only folks in the program, but that's really sort of who we had in mind. And so typically we've got folks working in a variety of areas within healthcare, but who didn't just start yesterday, and can kind of hit the ground running with their new skills and knowledge base in order to implement change. Along with your application, you're required to submit a CV that demonstrates your prior accomplishments, as well as 3 letters of recommendation. They can be from academic or professional settings. And in addition, a statement of purpose. So I think this is, pretty typical. That some application requirements might call it a personal essay, basically demonstrating compatibility of your background and career goals with the objectives of the program. So why are you and the program a good fit for each other? How does your background and interest and future goals, how do they feed into what the program is trying to accomplish? Why are you interested in this program? Why Johns Hopkins? Why now in your career? That sort of thing. And then for international students, we require an English proficiency exam scores to be submitted, either the TOEFL or IELTS, And then, of course, academic records from international institutions undergo a course-by-course credential evaluation. So if that's something that applies to you, but you have questions about, you can certainly ask, and we are happy to provide whatever information you need. We do submit all applications that we receive directly to the admissions committee on a rolling basis. So the earlier you apply, the better. We do encourage you to apply early, but the deadline is not for a little while yet. The deadline is June 1st of next year. So you've got 6 months, but don't take all 6 months. Better to get it in now. And we'll be happy to review your application as soon as we receive it. And everyone starts in the fall term. So for us, for next year, our academic calendar begins on August 28th. So classes will begin at the end of August. So this slide talks about tuition and financial aid, and I will just start by pointing out the asterisk. So the caveat is that the dollar amounts on this slide refer to the current academic year, 2022 to 23. The tuition amount itself, as well as scholarship amounts, are reassessed in the spring for the following fall. So we don't yet know what the exact dollar amounts will be for next year, but you can imagine it will be this year's probably plus a few dollars for cost of living increase. So for the current year, the cost of tuition is $1,270 per credit. So this being a part-time program, you don't have that full-time tuition bulk rate that full-time students would pay. You pay only for the credits for the courses that you take. We do also offer an OPAL scholarship, which covers about 67, I think, $488 per credit. And again, that's this year. So that takes $488 off of that $1,270. And your application for admission also serves as your application for the scholarship. So there's no separate process to apply for the scholarship. If you're offered admission to the program, you'll also be offered the scholarship. And beyond that, oh, sorry, now I'm that person whose phone is ringing. Beyond that, the financial aid office for the school does also provide assistance with navigating the availability of federal aid and private loans. And so we've put their contact information here at the bottom of the slide, their phone number and their general email address. So you can always ask us and or contact them directly if you have questions about other potential sources of aid for which you may qualify. So here's the QR code as promised that will link you directly to Sophus. And as well, I've put Morgan's email address here on this slide. If you have questions after today, if you have questions right now, please ask us. But if you have questions after today, you know how that goes. Sometimes 2 hours later, you think, oh, that's what I should have asked. This is not a once in a lifetime opportunity. We're here to help and answer your questions at any time.
So thanks, Liz. And we accepted our first applicant in September or October. So we're currently open for business. And we always get terrific applicants. I will say that something which is that the personal essay, you might call it, is particularly important and I think carries more weight in this program than it does in others. We feel that anyone who has the basic academic qualifications to be able to do the degree and to succeed, and who can really make a good case for how this attainment of this degree is going to help them in their careers and help them do more and better in the field of quality and safety. That is sufficient to us for admission. Some of our programs, our PhD programs, for example, might get 150 applicants and admit 3 students. and this is not that program, we will accept anyone who is qualified and could really benefit from the degree. So that is, in fact, all that I personally have to present right up front. But I wonder, Michelle, sort of you might not have seen this presentation either ever or not for a few years. Do you have anything? What can you add?
Right, I didn't actually see that presentation. I think I watched some other kind of a recording, but I mean, I've been able to proselytize how great the program is many times throughout the program and afterwards. And I guess a few of the things that people tend to be really interested in are, how many hours it really takes you in doing the homework and the reading and things. They're interested in what kind of online experience there is. People, maybe they wish that they were actually in Baltimore taking the classes, and how does that feel? And then how prepared did it really make me to do, the job that I wanted to do? How well did it perform? And what did I see, in my other classmates too? And I guess I'm happy to share lots of details about that, but basically it was an incredibly exhilarating online experience. The classmates that you were, I had classmates, 100 classmates or so from around the world sharing the heartaches of being in healthcare, and the problems we were running into that seemed like we were banging our heads against the wall for decades. And so it really felt the camaraderie there. And I have emails of classmates that we're still in contact, and that it wasn't just a didactic program, it really was a hands-on program. Partway through my first year, I had a big aha about a program that we could start at the hospital here, and sort of slogged my way through that, and had really great results in reducing readmission rates here. And it's just it's really working. I guess that's the main thing, and I don't think there's another program out there like it, because I've looked.
Well, I'm happy to. We didn't rehearse this. I'm happy to hear that. I can say that the students are terrific people, from sort of who are very multidisciplinary, and some are quite senior and some are quite new, and there are folks from all disciplines, really, including disciplines that are not medical or healthcare yet. Anyway, we have doctors and nurses and pharmacists and other healthcare workers. We've began to have dentists and even veterinarians. But we had a phlebotomist at one point. We've had techs. We have had someone from marketing communications. We've had people with business backgrounds, and it really winds up being we have people who are really at the beginning of their careers and barely have the years of experience. And we have people who've decided that they want to go back and retrain a little bit and just change direction. It's time for a refresh. So it's really fun to spend time with the classes, and we enjoy it, certainly. So we succeeded in getting through our canned material pretty quickly. We were privileged to get Michelle's uncanned sort of remarks, but this is your chance to ask any question that you might have about any aspect of the program, and you may speak or type in the chat, or both.
Yes, can y'all hear me?
Yes,
Yeah,
Yes.
this is now the time for the questions.
yeah, absolutely. This is it.
I'm sorry, my camera's not working at this terminal, but my name is Kirk Dotson. I'm a physician in Washington, Georgia, and practice outpatient, inpatient, nursing home, hospital, what have you, even hospice. And I'm particularly interested in Miss Wright's experience because it sounds like she's doing what I'm doing. I currently work in just 2 small hospitals, but I've worked in 4 of them in the surrounding area. And just really wanted to know what her experience was with the program in terms of, I think, you know, the unique challenges of a small hospital, primarily financial constraints. And sometimes, you know, old attitudes that don't change readily. What was your experience with that? How did you handle that? And did you think the program, you already mentioned it really helped you, you thought?
Yeah, a few things. Hi, Kirk. A few things in the program were helpful along those lines. I would say that actually the writing course was very helpful. Making a business case, there was many opportunities to practice and have feedback on making a business case for some quality projects or mindsets, thinking about things in terms of frameworks and how your organization may or may not be set up to succeed starting right up at the board level. And then thinking about technical challenges to change and distinguishing that from mindset or adaptive challenges to change, and that, you know, you really need to be able to do both things in order to make some lasting change. So
Right.
I think these were all things that I learned in the program. And I got to see other classmates sort of struggle with the same things that you're describing, and you know, bouncing ideas off each other in the live talks or in study sessions.
Right. I think perhaps an advantage of being in a small situation, though, is you work with people very closely and you can identify a problem and usually correct it pretty quickly. Whereas in the bigger facilities, that's kind of hard to do sometimes. So I think there's pros and cons both ways. Yeah. Okay. Well, thanks for the input.
Yeah, use that to your advantage.
Yeah.
Great question. And I really appreciate Michelle's answer. You know, again, we don't do systematic interviews with people to say, you know, what was your favorite course, or what were your couple of favorite courses? And I have heard people saying that the writing course was remarkable, you know, was surprisingly helpful. And it is really part of persuasion, or convincing your colleagues, some of whom maybe, you know, are not as open to ideas or to change as you wish they would be.
Yeah, and I'll just jump in and say that the instructor for the writing course, Brian Simpson, is really fantastic. He's the editor of the Johns Hopkins Public Health magazine and does really interesting things, both in his work and in the course. Students often tell me how great he is and how much they love the course. I know he does this sort of like mock radio program thing. People really just love it and find his input to be quite helpful.
This is your chance. Any other questions? We will answer any question. We'll even give you the answers to the questions on the exam. Oh, I'm getting ahead of myself. There's no exam, but yeah. What else can we tell you?
So this is Arti. I'm a pediatric hospitalist working in Tacoma, Washington. And my question really is about synchronous and asynchronous learning, because I work a lot. I do primarily shift work for my job. And so in terms of, you know, synchronous learning, are they on specific days of the week? Is there any flexibility with respect to, you know, those learning sessions? Oh,
great question. You know, it is the first thing is that we record everything. So if you cannot attend a live talk live, you can still rewind it and listen to it at some other time. They are those live talks are with the group in one or another course, and they generally happen. I think they generally tend to happen sort of a little bit in the late afternoon or early evening East Coast time, so that we can get a maximum number of people on board. And the date is set in advance, so you can book your schedule ahead. But sometimes, whether you're working or not, there's all sorts of reasons that sometimes you can't be live for a presentation. But I think it's second. The being able to view the live talk is recorded is second best. There is actually, at least in some of in some courses and at sometimes, there's quite a bit on the discussion board, the chat. And then people put sort of little study groups together. Over the course of a couple of years, and some people do honestly do the program over 4 years instead of 2 years. So people, or 3. So people might take 2 courses in one term and then only 1 course in another term. And as long as you finish all the courses by the end, you finish. So, but people have time to get to know each other. It's not maybe quicker to get to know someone in person, but by the time you've seen people on a few hundred Zooms, you figure out who they are and who's a little bit like you or complementary to you. And there are some really remarkable bonds that form between students. It's really kind of heartwarming.
That's great. Thank you so much for explaining that and going over that.
Arthi, I will say that mostly the lectures are pre-recorded, so you don't have to worry about being able to fit something into your schedule, because we know that people are, we made the programs 100% online so that we could have a global reach. And so we, understand that people are in all different time zones and won't necessarily be able to make whatever schedule we set for the synchronous sessions. So the lectures, that are delivering new material are pre-recorded and you can listen to when you're available. And most courses use the synchronous sessions for discussion or additional presentations. But as Albert said, they were recorded so that, again, we understand everyone has different schedules.
The courses too, the lectures are recorded with video. Someone confessed to me that you can play them at 1.5 or 2 times speed, and so people sound like they've inhaled helium, but you can get through a lecture, or you can re-review a lecture pretty quickly if you have the need to do that. You can also simply listen to what is spoken. Most lectures do not absolutely require that you study every single slide. And so you can consume them as a podcast. Some people have listened to some of the lectures I've heard or re-listened to them, reviewed them in the car as if they were podcasts. So there's a few options.
I have a question about the application process.
Yeah.
Obviously, part of the process depends on others in terms of submitting, your references or the transcripts, and that, you're kind of paralyzed by what somebody else does in that process. Is it best just to submit the application partially and then wait to get all that material, or just submit it all at one time?
It's probably better to submit it all at one time. It's occasionally we might get something that's missing a letter of reference, and we might have 2 letters instead of 3 letters, but we mostly review applications that are complete. So I would, I think that it's probably in general better to put it all together and send it in.
Okay, thanks.
And I would just give a little bit of a caveat on that, maybe, that certainly for any students who may have international coursework that they're going to need to deal with, to address. If you're going to be waiting for an evaluation, I would encourage you probably to just go ahead and submit with all the materials that you have. And there are some minimum items, obviously all of your background, personal information, you'll need to submit in SOFIS. You'll need to have that completed before you can submit, and paying the application fee and whatnot. But yeah, definitely if you're an international student, I would suggest submit earlier rather than later, because we know that those credentials will take a lot of time, sometimes more time than you would hope or expect. And that way we can keep an eye on what's happening with you. And certainly, if you're, say, if, in the next month or so, if you're working on your application and can get all those materials together and ready to just submit as at once as one full package, as Dr. Wu said, and that's great. And that will just help us to, quickly scan through your materials and hopefully get it right over to the admissions committee. But if you're starting the process, especially as we get closer in the coming months to the deadline, I would say it's, only in your best interest to submit as soon as possible. And that way we can just keep an eye on the materials that you have collected already. If, for example, if there are any hiccups with your, say, domestic transcripts, or just, as you said, in terms of the timing of getting recommendations in from your recommenders, that sort of thing, we can, keep an eye on that, monitor that, and touch base with you with any issues, because we'll watch that. And basically, we have an idea what's a typical sort of slow progress versus, we're getting to the point where this might be, becoming a critical timing issue that we want to address. And for example, you may have 3 recommenders in mind that you feel very strongly about. So you want to submit those, but, maybe someone is, they're traveling or on vacation. So you might want to have an alternate for one of them just in case. And that way we might see the needed recommendations come in sooner rather than later. And then we can always add that additional recommendation when it comes in to the overall package.
Okay, thank you.
Mm-hmm.
Other questions? I understand that some of you may just be sort of soaking it in and trying to figure out how this fits. I'll say too that, thinking about transcripts, I think that some people come in and submit, sort of the perfect transcript from the point of view of either an admissions officer or, or someone's mother. They're really, everything is in perfect shape. But honestly, people come into this field in different ways. We once had someone submit an application who had attended 9 community colleges over 15 years, each one for about a year at a time. With my normal admissions hat on, I would say, I'd look at that and say emotionally unstable. But in fact, looking at it more carefully, you could see that this person was in the military and had moved around a great deal, but had been plugging away steadily from a more basic level to quite a high level. And this person was now doing some really important things in the US military related to quality and safety. And in the end, really benefited from the program, I think, being able to now, this is someone who didn't have wasn't a physician or wasn't a nurse, but accumulated a lot of experience and got some extra knowledge that was really helpful, from the program. So your transcript doesn't need to be spotless. If you can explain, why this is helpful and how you got where you got, That is in some cases even more convincing. It may be that we have, as my psychiatrist says, we may be coming to the end of our time together.
Any other questions before we part ways for the afternoon?
I think we're going to wrap up. Extra thanks to Michelle for volunteering to pop on and join us. And thank you all for spending the morning with us. Or is it the morning? It's
Morning somewhere.
Somewhere it's morning somewhere.
Isn't that what they say? It's morning somewhere.
I think so. Yeah, or it's or it's happy hour somewhere or something. Wait a second. We're in a school of public health. We shouldn't get it. But anyway, thank you for joining us. If you have any questions, please be in contact. We're happy to talk on email, by phone, whatever is useful. Kirk? I'm sorry, Kirk, did you have something?
Oh, no, sir.
Thank you so much. I hope you have a lovely day and a great weekend. And if you decide that this makes sense, we would love to see your application.
Thanks, everyone.
Thank you.